What to learn to unlearn today. Hi, welcome to LaVhealthy Podcast, the safe space for uncomfortable wellness truths. I am delighted to be with Aqsa Khatib, a compassionate CBT practitioner on VHealthy with a master in counseling psychology from MMP Shah College, University in Mumbai. She has a background in family and couple therapy, neuro-linguistic programming, and crisis counseling. She specialized in anxiety, trauma, grief, and relationship challenges, and already worked with several individuals. Aksha's integrative approach is drawing from ACT, solution-focused therapies, and transactional analysis, combined with her culturally sensitive multilingual practice, which makes her trusted guide for anyone seeking clarity, emotional healing, and growth. So hi, Aksha, and thanks so much for your time today.
Hi. Thank you so much for such a warm introduction. I am really delighted to be here as well. So it's a great opportunity to share my experience with Be Healthy platform, and it's great being part of it and being associated with this since a long time.
Thank you so much. To kickstart the discussion, could you tell me a bit more about what's the biggest misconception people have about your work?
So although there are a couple of misconceptions that is existing, let's just start from busting couple of myths as much as we can in this little podcast so that people are aware about it. So the first misconception I would say is we do read minds. So that is something which is very often when they come, they see it, and a lot of people that tell me okay, tell me what's on in my mind. Oh, now you know that. Tell me what am I going to do. So I have to say that it's not astrology, it's psychology. And what we can do is we have evidence-based approaches. We have we do observe the patterns, the behavioral things, the actions, and we have a lot of assessments and observation as per the lot of evidences and researches that has been happened. And on that basis, we do the treatment planning. We do help the person to get a little insight and introspect their patterns and bring self-awareness. So it's I would like to summarize this thing as that we do help individuals understand their patterns. Yes, we do observe and analyze, but that doesn't mean we can control and predict everything. It's if I have to say it in a little light-hearted way, we cannot control inflation, we cannot control politics, and we cannot control people's minds. We can only help them bring awareness and work together. So that is it.
And as part of your work, do you have any specific technique, or I guess you have several clients with different background, different expectation. How do you cope with that?
Yes, so I have had a lot of experience working with different clients, and I would say every client is different. Although there are some common patterns and problems, couple related problems, breakup patterns, self improvement, and much more. There are common patterns also, but at the same time, I feel every individual have their own personality, their own strength and achievements, and something that brings new to the table, to the session. So for me, I believe an eclectic approach, which means combining all the techniques and then using what will be beneficial for the client. Like if a client who is into expressive arts, who is much more into open with regards to play therapy, with regards to creativity, imagination, I would go into gestalt therapy, expressive writing, reading, coloring. If someone who is much more into technical and would love to know about the psychology and how the mind works, then I will approach to CBT. That is how you can understand your own thoughts, and then psychodynamic approach and a lot of other things. And I combine everything in a way which is also interesting. So there are times where I say that therapy is not only talk therapy, and it doesn't have to be very boring where you're just sitting and talking about problems. It can also be full of insights. It can also be full of interesting things, playing games, self exploration, sharing that moment with your therapist, and then having a little just what do you like, how would you like to do it, what are your achievements. So I feel like it is a very wholesome moment. Like therapy is full of emotions, like from happy emotions to confusion to like introspections to some amazing moments that you can take away while sipping your coffee as well. So I do not mind if my client is in front of me sipping a coffee and then sharing. So a lot of my clients, throughout the process, they share their happy moments, their sad moments, and I'm open for that space using all the techniques combining and using what will help my client the most. So an eclectic based approach.
Okay, that's great, especially seeing your background. So just to recap, you have expertise in CBT, which is cognitive behavioral therapy, and NLP, neuro-linguistic programming, as so on and so forth. Could you just briefly
Yes.
explain what are the differences between those therapy for those who are not really familiar with those terms?
Absolutely. So CBT, it would be cognitive behavioral therapy, as you said. So it's more of understanding the thoughts, restructuring. For example, if someone who is very much, prone to self-blaming or doesn't know how his thinking is affecting his mood. So I will be bringing the awareness of how their thought process is affecting their circumstances, their life, and how restructuring thoughts can actually bring different outcomes. So teaching that model to the client, helping them understand their own maladaptive thoughts. Whereas NLP, that is Neuro-Linguistic Programming, will help understand their past, their how past situation has, incorporated them, how past is affecting them, and how they can, create new memories, how with the language, how with visualization, a lot of visualization, anchoring, going back, and just explaining how you can heal from your past to present and redefine your future. So there are a lot of experiential techniques happening, visualization, guided imagery, a lot of gestalt therapy, and a lot of other things in NLP. So it is much more of understanding the past using a different language and using and applying techniques basically. And it is much more of experiential where you are given a stimulation, like an environment where you are connecting with all of your senses, like your auditory senses, your visual senses, your touch. So you are made to just imagine and then reshape those memories in the present and in future with a positive way. So that is the difference between CBT and NLP. So it depends. Like CBT is basically a short form. It can be happened in 6 sessions, but for NLP, it might take some more time to just get in touch with your past, present, and reshape the future.
Oh, that's really interesting, and it seems really tailored also to the person.
Yes.
Actually, I was wondering, and that's something I also heard from our audience, that with all those healers, coaches, etc., out there online, how can someone feel safe choosing a certified expert like you, for instance?
So, like, this is a very fair question because there are a lot of people who are also coming up as listeners or healers, or someone who is a very professional, like psychologist, psychiatrist, clinical psychologist, counseling psychologist. So, all of us are like we have done masters and bachelors a whole lot of years and years. But healer, it is something sometimes anyone can just do a crash course and become. So, which is also like a good thing. But at times there are, incidences where a professional guidance and experience will help them depending upon their concern. So it is always good to check the credibility, check the licenses as well. Like for different continents, there are different licenses. Like in UK, in Canada, there is a different major. In Europe, it's different. In India, it's different. So you have to check the credibility as well on the website. And I think on We Healthy, we do have the certifications and credibility where one can check what their qualifications are, what their credibility are. So if I'm like, for example, I'm from India, so my credibility has to be masters in counseling psychology with a certain kind of hours of sessions that I have taken. Only then I can like practice as a listener, as a psychologist, as a mind coach, as a life coach, and interact with other audiences.
Yes. Thanks a lot for this insight, as indeed it's quite challenging to evaluate broad field and the experience or the background of each expert, especially cognizant of the fact that diplomas are not harmonized worldwide. But this is always reassuring to see that indeed you ran through a lot of hours of work, expertise, and many clients.
The sense of contentment. I believe, having contentment in the present moment. I often say that you are the main character. You are the hero of your story. You can recreate the narrative. If you're not happy with what has been, take the control what you can. There are certain things we cannot control, but whatever is possible, just grab it. Imagine you are the main character of your picture. Create the story. If you're not liking it, add plot, add climax, add things of experimenting a lot of things, and make sure that you are carrying away with a sense of contentment, that you are happy so far what has happened, what you are doing, and what you are manifesting in the future. You are happy with it.
Thank you so much. Is there anything else you would like to add or good experience you would like to share?
Yes. So I would likely prefer sharing this personal advice from my experience. Is a lot of times what happens, like we think that therapy is something which is supposed to be taken only when there is a serious concern, or it is just the talk therapy. But I would like to say that a lot of times, like I am a couple therapist as well. I do see a lot of couples and I do see a lot of individuals. They come to me when the problem has escalated so much that they have adapted a lot of unhealthy habits. For example, they are suffering, they are suppressing their emotions. So the emotional bond, the empathy level, their way of, people around them is so low that they have lost hope. They have lost, affection with other people. And then they are like, engaging into maladaptive habits like smoking, alcohol, and other with bad coping mechanisms. So sometimes it's okay, even if you feel like minor confusion, even if you want clarity, even if you feel like you just want to try it out and see how you can improve yourself, self development, self improvement. So I think therapy should be like, not seen as only when there is a major problem, but it can also be just done as a way of self care, just as a routine, just for checking in yourself, just like how we take care of our physical health, just to see that if we do not have like any baggages or emotional burden, and how we can keep on regulating ourselves. So that is the advice I would like to say, that just try therapy once or twice and see which therapist fits for you, with whom you can jam up, with whom you can just regularly check in and have a bond, and commit to your self-care and emotional well-being.
I totally connect with what you said in the sense of we tend to check regularly. In France, for instance, we have this campaign about testing for breast cancer yearly, always like anticipating and preventing about any physical disease. I truly believe that the same should go with the psychological or emotional assessment should be done on a regular basis also. Whether you're feeling great or you're not feeling great, it's always great to be at the best of ourselves. This is like a society construct, taboo topic, something people are not comfortable. What's your view about it?
There are a lot of stigmatized beliefs, like for me in the Indian culture, and if you see even at certain cultural way, it is viewed as okay, you just need to connect spiritually. It is okay, you can manage things on your own, you are an adult. But for me, I have came across people and clients who are 80 years old, 75 years old, and it feels like, a sense of maybe I would say, like it gives me a kind of, hope that yes, everyone can benefit from therapy. It's not only about dealing with problems, but it is also about having a safe space to vent out, a safe space to share the emotion that they never shared with anybody else. So the way society, the way cultural perspective and stigma which is existing, I would like to burst everything and I say that just spirituality and psychology sometimes can go hand in hand. It doesn't matter what religion, what caste, what culture, what your belief system are. If you believe in God or if you don't believe in God, you can try. And I think it is very like, personal thing to say that it is not about cultural, it is not about religion, it is about your own self. It is prioritizing yourself, it is prioritizing your mental well-being and how you can flourish. So I always say, my people, you can only pour, you can only contribute to other people if your cup is filled. If you are empty, if you don't know what you are doing, how you can offer to other people, how you can give, how you can be present, how you can function. So fill your cup with kindness, fill your cup with self-care, fill your cup with the love you always wanted from other people, and then see how things change and how you see yourself. It's like working on your self-identity, self-esteem, and feeling little blessed, content, and happy in your present moment, trying to build a better future, overcoming the past incidents.
Thank you so much, Aksha, for sharing your experience, your view, and more information about your field. Thank you for tuning into LaVhealthy Podcast. The podcast is a space and a step towards a healthier and happy you. Thanks again.
Thank you so much. Thank you. It was a pleasure to be here and be part of it.